primary source. The information is based on clinical warnings provided by Dr. Sarah Mitchell, as mentioned in the transcript, and research published in PLOS Medicine, medical institutions, peer-reviewed studies from institutions like the British Medical Journal, BMJ, and the National Kidney Foundation, NKF, have long warned about the interaction between ACE inhibitors, diuretics, and NSAIDs. Key concept: the triple whammy effect, a term coined by pharmacologists to describe the acute kidney injury caused by the simultaneous use of these three classes of drugs. The silent nature of kidney damage and the case of Margaret. The story of Margaret serves as a critical warning for everyone managing hypertension. Despite following every medical instruction, attending all her appointments, and feeling perfectly healthy, Margaret's kidneys were suffering from silent, progressive damage. Her creatinine levels, a primary indicator of kidney stress, had risen significantly over a year. The underlying cause was moderate renal artery stenosis that had gone undetected. While her medication, lisinopril, did not cause the narrowing of her arteries, it placed a continuous, unmonitored strain on her compromised vessels for 12 months. This highlights a terrifying reality. Kidney disease in its early stages is almost entirely asymptomatic. By the time physical signs like swollen ankles or fatigue appear, a patient may have already lost a substantial percentage of their total kidney function. This section emphasizes that feeling fine is not a reliable metric for kidney health. The triple whammy, a perfect storm in your bloodstream. The most dangerous threat to kidney health for seniors often comes from a combination of three common medications: ACE inhibitors, or ARBs, diuretics, and NSAIDs, like ibuprofen or naproxen. Each of these drugs affects kidney hemodynamics differently. Diuretics reduce fluid volume. ACE inhibitors lower the pressure within the kidney's filtration units, and NSAIDs block prostaglandins, which are essential for keeping the kidney's internal blood vessels open. When taken together, they create a perfect storm that drastically reduces blood flow and filtration capacity. Research indicates that this specific combination triples the risk of hospital admission for acute kidney injury. The tragedy is that this often happens accidentally. A patient might get one prescription from a cardiologist, another from an internist, and pick up a common painkiller at the grocery store without realizing the lethal interaction occurring inside their body. Understanding the metrics, creatinine and GFR. To manage what you cannot feel, you must rely on objective data. The two most vital numbers for any patient over 60 are creatinine and GFR, glomerular filtration rate. Creatinine is a waste product that builds up in the blood when kidneys aren't filtering effectively. GFR is a calculated value that tells you exactly what percentage of your kidney function is still intact. A GFR above 90 is considered normal, while a score between 60 and 89 indicates a mild decline. Once the GFR drops below 60, it signifies moderate chronic kidney disease, and levels below 30 indicate a serious medical emergency. This section explains that the only way to catch kidney decline early enough to intervene is through consistent blood testing. If you are on blood pressure medication, these tests are not optional. They are the only window into your internal health. The power of knowledge and clinical advocacy. The story of Frank provides a blueprint for successful intervention. At 74, Frank's GFR had dropped to 54 due to a combination of diuretics, ACE inhibitors, and regular ibuprofen use. By identifying the decline early, his doctor was able to switch his pain management to acetaminophen and optimize his hydration. While his kidney function did not fully recover, as lost kidney tissue rarely regenerates, the decline was halted. Frank avoided the path toward dialysis and maintained stable health for years. The final lesson is advocacy. Always bring a complete list of every supplement and over-the-counter drug to every doctor's visit. Because different specialists may prescribe different drugs, you must be the one to ensure everyone has the big picture. Knowledge. is the ultimate tool in preventing irreversible harm and ensuring your kidneys continue to serve you throughout your life.